Okay.
Hello and welcome to Inside Healthcare. I'm Jody Rataga, and we're going to be talking about the flu. Health officials say that it is most severe than it's been in 15 years around the country. And joining us to talk about the flu, we're glad to have Dr. Christy Tresso with the Urgency Room with us again. So thank you for being with us. So what are you currently seeing? I know they're saying it's everywhere around the country. What are you currently seeing here at the Urgency Room?
Yes, we're seeing lots and lots and lots and lots of patients with influenza, particularly influenza A. And we're seeing it in all age groups, the young, the old, and everybody in between.
Yeah, I was going to ask who's at most risk for this. So,
Well, we're seeing patients of all ages with influenza. Certainly the patients that are at the highest risk are the very young patients, particularly children under the age of 4. And also patients that are older, so patients older 65, and those patients with chronic medical conditions, particularly underlying heart and lung conditions, are at high risk from getting very ill from the flu.
I think I'd rather it's like 20 some million people that have the flu, and there's like 310,000 or something like that that are hospitalized, and there have been some deaths, some thousands of deaths, and including some children. So, what would be the symptoms of the flu that people are experiencing right now?
So influenza is a viral respiratory illness that causes fever, cough, congestion, body aches. Some patients also get GI symptoms like vomiting and diarrhea.
Yeah, one of my youngest granddaughters actually on Monday, she was sick overnight, had a fever, had cough and stuff. So I know firsthand seeing this happening. And I know another friend of mine, she had said that she just thought she had the flu, and then finally it wasn't going away. She found out that she had pneumonia too. So it had gone into another secondary infection.
So anytime you have viral illness, viral respiratory illness, pneumonia is a risk. So we particularly tell patients that if you've had symptoms for a while, so more than a couple of days, and are just not getting any better, or if you have persistent high fevers or are getting short of breath, those are really things that we would want to see you for at the urgency room to check for those complications like pneumonia, low oxygen levels. Another complication of influenza is dehydration. So having high fever, vomiting, diarrhea, sometimes patients get very behind on their fluids and can become dehydrated. That's particularly true for younger children who are just in general higher risk for dehydration from illness because they're just simply smaller.
So what kind of advice would you have so they don't get dehydrated or they're battling it? What advice do you give?
Yeah, so oral hydration at home is a great technique. And then fever control. So having a high fever just simply increases the body's demand for fluid and how much fluids the body's using. So fever control, Tylenol and ibuprofen, as long as you don't have a medical condition that's for which ibuprofen is contraindicated, but being really consistent with fever control, and then drinking fluids really regularly, small sips of fluids more often. And then if you're seeing signs of dehydration, such as low urine output, being very fatigued, feeling very dry in the mouth, the lips, and for feeling very lethargic, or particularly for kids, if they're really acting lethargic, then those are signs of dehydration. We'd want to see you for those.
And very important, as you mentioned, if, to go for emergency care at the urgency care, emergency room, let them know why they should be coming there to the urgency room.
Yeah, we see lots of patients for respiratory complaints, fever, cough, congestion. Certainly, if you're feeling short of breath, if you feel that you're dehydrated, or if you've had symptoms for several days and feel like you're getting worse rather than better, those are all signs that you should be seen so we can check for complications such as pneumonia, dehydration, and make sure there's nothing else going on.
Well, Dr. Christy Trusso, always a pleasure to have you on Inside Healthcare. Thank you again.
Thank you for having me.
Hello and welcome to Inside Healthcare. I'm Jody Ritaka. Today we're going to be talking about heart care and women in particular. And joining us, we're very pleased to have back with us Dr. Christy Trusso with Urgency Room. So thank you for being with us.
Thank you for having me.
What are the risk factors for someone to have heart conditions and things like that, and that maybe prevent getting it? What would those risk factors be?
So for vascular disease, which heart disease falls into, the main risk factors are kind of those metabolic health things. So high cholesterol, high blood pressure, having diabetes or high blood sugars are really kind of big risk factors for having heart disease. Smoking is also a big risk factor for vascular disease in general and heart disease.
And what would be some advice to prevent some of those conditions and stuff so you don't end up having heart disease?
So a lot of prevention for cardiovascular disease comes through your wellness visits with your primary care doctor. So that means getting blood pressure checked, getting cholesterol checked, and managing high cholesterol levels, getting screened for diabetes, and managing managing higher blood sugars, diabetes risk factors, healthy lifestyle such as healthy diet, good exercise habits, and then quitting smoking. If for patients that smoke, quitting smoking is an excellent way to reduce your cardiovascular risk.
And what would be some of those warning signs? And women, I think some people still think it's just a man's disease, but it affects women as much as men.
Yes, both women and men suffer from heart attacks and vascular disease. Not everybody has, men or women have the classic symptoms of, crushing chest pain, the elephant on the chest with shortness of breath and jaw pain. So, some patients do have those very classic symptoms, and those are absolutely things that you should be seen for. Some patients have more subtle symptoms to suggest heart attack, and that can be things that are more vague, like nausea, indigestion. I've certainly had patients who say, "Ooh, I feel like I'm having indigestion and just kind of this vague chest discomfort with that," and it turns out to be a serious heart attack. Um, not all heart attacks cause pain on the left. Sometimes pain is on the right, or in the back, or the neck, or the jaw. So we are very careful for symptoms from anywhere between the belly button and the jaw for screening for heart conditions, particularly in patients with risk factors. Some patients have no pain at all. It's simply nausea, fatigue, exercise intolerance, lethargy, weakness. So it's very important to just kind of keep an eye on how you're feeling. And if something's new or worrisome, get checked out for those symptoms.
Yeah, and make sure that you go to seek emergency care at the urgency room. And why would that be? People think, oh, well, I'll be okay. I'll be okay.
Well, heart disease can cause, it's heart disease is a very serious medical condition. Patients who have acute heart attacks, the sooner that you're evaluated, the better your outcome. Um, and we certainly want to sort out those symptoms, check for serious heart conditions, but also make sure that there's not other processes going on like blood clots or excessively high blood pressure. There's a lot of conditions that can cause vague symptoms, and we at the urgency room take care to sort through those and identify serious problems.
And I've been hearing too, a lot of the hospitals, the waiting line are really long. So the sooner you can get in, the better it is. In an urgency room, you're available at 3 locations.
Yeah, we have locations in Vadnais Heights, Eagan, and Woodbury.
Any final advice for someone to, live healthy and avoid having heart problems
I
during this?
think good primary care is really the key. Having that point with a regular doctor who can help you manage things like blood pressure, blood sugar, cholesterol over time to really mitigate those risks. Um, no prevention strategy is perfect, and certainly if you have new or concerning symptoms, we'd be happy to evaluate them.
Well, Dr. Christy Trussell with Urgency Room, it's always a pleasure to have you on Inside Healthcare. Thank you.
Thank you.